All right, so subscapularis is one of the rotator cuff muscles, of course, and this one is anterior to the scapula, so it is typically hard to address, but we are going to. So Chelsea, I need to move this a little bit. Okay. I'm going to put your arm down for a second, and what I'm going to do is just kind of tuck this under you, if that's okay. There we go, just for demonstration. All right. So to get to subscapularis, remember, we need to be on the anterior scapula. So in order to do that, we need to find the anterior scapula. So wherever you feel like lats probably are, as their body comes up and makes that V at the axilla, we're going to palpate towards the body here, okay? And find the lateral edge of the scapula. Just so we have an idea where it is. Okay. All right, it's back there. So it's actually back under the body a little bit. So you might have to palpate for a minute before you find it. Now, we're going to turn our hand over and we're going to use our knuckles. We're going to put them against the ribs on the side here. Okay, so my knuckles are against the ribs. I feel her ribs. I'm not poking her in the ribs. That's just my landmark. Okay. Now, I'm going to take my fingers and I'm going to follow the ribs down towards the back. You see where I am now? Okay. Now this isn't the move. The move is this. I'm going to bring her arm up and across her body. This takes the scapula and moves it laterally and brings it up to meet my knuckles. Do you feel that, Chelsea?
Yes.
Is that okay?
Yeah, it's a little tender, but
okay. And that's all I need to do right now. Okay. If we want to address that muscle, we can move our fingers inferior and superior just a tiny bit as we're on. It's really the lateral edge of subscapularis. All right. Okay. Yeah, it's weird and it's not super comfortable because it's never going to be when you're getting somebody underneath their scapula. But there is a slightly more comfortable position, and that is sideline. So let's take a bolster. Thank you. All right, Chelsea, I'm going to have you roll onto your side facing the opposite wall. Perfect. Now, I want you to bring this arm up and on. Okay. So in this position, it's basically the same thing, okay? Except I'm going the opposite direction, okay? So I had my knuckles in subscapularis and I was pulling her arm across her body. Now I'm doing basically the same thing, except I have a little bit more, a better idea of where her lateral border of her scapula is. It's right here. Okay. So I know that my fingers need to be anterior to that, but I don't want to be in her axilla. So I'm going to come down right about to here. Okay. Now I can use my knuckles here as well. And in this case, I'm just going to pull her arm forward. Okay, so I'm just leaning back. I have her at the elbow, and I'm just leaning back. Is that better? That one's less intense? Yeah. The other thing that I can do then, if she really needs some work in there, is I can come in with my thumb and work in there, that anterior section on the lateral border of the scapula there. Okay. But thumbs tend to be pokey, so I caution you. And you can also do a bit of a pin and stretch with that too. That's still less intense than the other. Yeah.
It's a little more intense, but
Right. But it's
Bigger
not
one.
as, yeah, it's not as bad as when you're putting your knuckles in towards the table. That one's also a little more challenging just because you have to put your fingers against the ribs and follow them down around the table. So I do want you to try both ways to see which works for you and which works for your partner and you know which one you like better. And just so that you have options. Okay? Thank you, Chelsea.
are you showing anything else?